It's being billed as a landmark change to the healthcare system. From today, Medicare is being extended to some nurses and their patients. So-called nurse practitioners will be able to prescribe medications that are subsidised by the Pharmaceutical Benefits Scheme and provide services such as seeing elderly patients at home, which previously would have required a doctor's attendance to qualify for the Medicare rebate. Rhian Parker is Associate Professor at the Australian Primary Healthcare Research Institute at ANU in Canberra.
Well, it's significant because for the first time nurse practitioners working in primary care in Australia will be able to access the Medicare provider numbers and pharmaceutical benefit rights.
Now, you've carried out research into these changes. What are patients' attitudes towards nurse practitioners?
Well, actually, they're very accepting of the role of nurse practitioners as long as they know that they are properly trained and that they work within their scope of practice. They're a bit confused about nursing in primary care because there are a whole range of nurses working in primary care, so they need some explanation about that. But they are very accepting of nurse practitioners to do things like give them repeat scripts or see them for some everyday health concerns.
And will patients be able to choose whether they see a nurse practitioner or see a GP?
Well, that depends on the area they're in, obviously, but they want that choice. They want to be able to make the decision whether they see a nurse practitioner or whether they see a GP. And for people who live in areas where there aren't many GPs, they just want access to health care, whether it's from a nurse practitioner or a GP or anybody who's there, really.
So presumably it's going to make it easier to get an appointment.
Well, that's what people hope. That's what consumers hope, that it's easier to get an appointment, so they have appointments in a more timely manner, but also they want it to be more affordable. They think perhaps it would be more affordable to see a nurse practitioner rather than a GP.
What about doctors? They've criticised the change, saying it'll generate what they've called turnstile medicine because it rewards numbers treated rather than the quality of care. And they also are worried that it'll fragment patient care.
Well, I think primary care in many parts of the world, including Australia, now is about multidisciplinary care, and no one health provider can do everything. So I think it's about getting health providers to do what they're really good at. We know that nurses are really good at patient compliance, and they spend a lot of time with patients, and patient trusts them.
Rhian Parker, thank you.
Thank you.